CEN Test Prep Exam July 2018. Question 1. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. Question 2. A female patient of childbearing age with abdominal pain should always be evaluated for: Option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Question 3. Which finding is consistent with an anterior shoulder dislocation? Option A, arm held in internal rotation and adduction. Option B, arm held in external rotation and slight abduction. Option C, patient unable to flex the elbow. Option D, numbness of the medial forearm. The correct answer is option B, arm held in external rotation and slight abduction. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. Question 5. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is: Option A, diltiazem. Option B, verapamil. Option C, metoprolol. Option D, digoxin. The correct answer is option D, digoxin. Question 6. The most common cause of airway obstruction in an unconscious patient is: Option A, laryngospasm. Option B, foreign body aspiration. Option C, the tongue. Option D, mucosal edema. The correct answer is option C, the tongue. Question 7. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects: Option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Question 8. In distributive shock, the primary pathophysiology is: Option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with cholinergic symptoms: salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by: Option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option C, cholinergics, organophosphates. Question 10. Necrotizing fasciitis requires what priority treatment? Option A, broad-spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Question 11. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, a synchronized cardioversion at 100 J. Option C, immediate high-quality CPR and defibrillation. Option D, a transcutaneous pacing. The correct answer is option C, immediate high-quality CPR and defibrillation. Question 12. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. Question 13. Priapism is a urological emergency characterized by option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, a scrotal edema. The correct answer is option A, painful, prolonged erection. Question 14. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Question 15. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option C, red, immediate. Question 16. Meningitis is an inflammation of the option A, a brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 17. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option A, acute glaucoma. Option B, a retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. Question 18. The best method to remove a prosthetic eye in an emergency is option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. Question 20. Ovarian torsion presents with option A, bilateral lower quadrant pain. Option B, a sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, a fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea. Question 21. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 22. Le-Fort fractures are classifications of fractures of the option A, mandible. Option B, mid-face and maxilla. Option C, orbit. Option D, nasal bones. The correct answer is option B, mid-face and maxilla. Question 23. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotality. The correct answer is option D, administration of antivenom, crotality. Question 24. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss. The correct answer is option B, diverticulosis. Question 25. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray. Option B, a needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space.